Greetings. My name is Phil Settels. I am a student of Dr. Huang Huang's, and I'm the Dean of the Doctorate Program at the Academy of Chinese Culture and Health Sciences in Oakland, California. I have my own clinical practice as well for the last 10 or 11 years, and I see patients using both acupuncture and herbal formulas, and all my herbal formula application is Jing Fang. It's focused on the clinical application of classical formulas. Today, it's my pleasure to speak with you about selected cases of Zhenwu Tang. I will start the presentation with addressing the question of the use of older formulas for modern patients. I'll then speak a little bit about formula presentation, Fang Zheng, and then introduce the formula presentation for Zhenwu Tang. I'll present three brief case studies from my own clinical practice. The first focused on fatigue, the second on knee pain, the third on swelling in the legs. So a question does arise in our field: can classical formulas from 1800 years ago treat modern patients? And there are different opinions on the answer to this question. One of these opinions was well expressed a long time ago by Dr. Zhang Yuansu, who said the movements of qi are not uniform. Past and present do not move on the same track. Old formulas are not suitable for new disorders. And Zhang Yuansu definitely has an impact and followers later on in history who've expressed this same sentiment, that as new conditions arise, new formulas are needed, new theories, new combinations, new strategies that were not present in the works of Zhang Zhongjing. A very different opinion is expressed by Dr. Huang Huang when he wrote that diseases will continue to evolve and change. However, the human body's response to diseases does not change at all. Herbal indications are diagnostic and reflect the pathological responses of the human being, regardless of the type of pathogen. The herbal indications are stable with nearly no change in thousands of years, and they will not change even with new or changing diseases. There is an adage in Chinese medicine that advises us to treat each situation according to the person. One of the ways in which Chinese medicine distinguishes itself is by its focus on treating the person and not the disease. This is the basis of flexible, individualized treatment that we hold as our ideal. We even hear of individualized treatment right now in modern medicine, and we recognize this was an ancient idea for Chinese medicine. This goes back to the classics, that you do not treat the disease, but rather the person. If we go back to these statements by Zhang Yuansu, we can see that Dr. Zhang was focused on the movement and qi being different and new disorders being different. Whereas Dr. Huang Huang really emphasizes that the human body's response has not changed in these 1800 years, and so the different manifestations remain clinically relevant today as they did then in the times of Zhang Zhongjing. So I'll illustrate, I think, what can be a common pitfall in our field with a case study from my own experience. One of the very first day that I was a licensed practicing Chinese medicine physician in California. So this was about 11 years ago. I had a patient come in who was a female in her 60s, and it was winter, and she had caught the common cold. She had a sense of chills and fever, generalized body pain, and lack of sweating. Taking her pulse, I felt that it was floating, very easy to palpate, and it had a tight quality to it. And she had a pink tongue with a thin white coat. So I felt confident in thinking about textbook patterns from my education, that she had a wind cold with exterior excess. Cold binding up, freezing the fluids in the exterior, closing the pores, the zhou li, not allowing sweat to issue, and causing fever and body aches, generalized body pain. So I prescribed the formula that treats this condition, Ma Huang Tang. And the results were that her cold symptoms improved, but otherwise this proved disastrous for the patient. She had really profuse sweating, agitation, experienced insomnia that night, and when she came back in the next day, she felt like her head was going to pop off. This was not the desired effect of the formula, even if the cold symptoms themselves, the chills, fever, and generalized body pain, had seemed to improve. And so I had to reflect on the situation and why the outcome that had occurred really had occurred. This person had signs and symptoms that indicated a pattern of disharmony, and the pattern had a corresponding treatment principle, which in turn had a corresponding prescription. In the end, the prescription did not suit the person. So every one of these steps to follow these arrows was a logical step with good reasoning. I could justify every decision along this line, this chain of transmission, but in the end, the formula did not match the person. And so if I was treating, if I chose my formula to suit a treatment principle that would treat a pattern of disharmony, I had lost sight of who the patient was. A description of the type of person for whom Ma Huang is appropriate, its herb presentation, or Yao Zheng, describes someone who is slightly fat or just has flesh on their body with a robust body, some strength, dark yellow complexion, slight edema, and who tends to feel heaviness and soreness. My patient, on the other hand, was older, thin, without much flesh, and a generally nervous disposition. With an appreciation of the tendencies, the Yao Zheng for Ma Huang, I would have immediately ruled out this herb method and saved the patient suffering. What are these things called Zheng? Zheng are manifestations. They also constitute criteria for using medicinals. The various items in the treatise on cold damage and the essentials from the golden casket, the text of Jing, such as heat effusion, aversion to cold, stretch stiff nape and back, and so on. These are all manifestations. All of these manifestations cannot be entirely comprehended by studying the text. They require explanation by a teacher or precise and clear annotations. This is what I previously referred to as the correct method for reading the treatise on cold damage and the essentials from the golden casket. This is from the Shanghai physician Liu Yuanlei, a leading reformer of Chinese medicine in China during the Republican era. So he gives what I think is a very approachable, understandable definition of Zheng, being the manifestations and the criteria for using medicinals. And he advises us that they require explanation by a teacher or precise and clear annotations, historical guidance on the understanding and the use of these Zheng. So if we look at Zhenwu Tang and its formula presentation, it's Fang Zheng. From the original lines, it tells us in line 82 that there's fever, palpitations below the heart, dizziness, jerking and jumping of the body's sinews and muscles, trembling, inability to stand as if about to fall. In line 316, it tells us abdominal pain, abnormal urination, heavy sensation and pain in the extremities, and spontaneous diarrhea. The keys, according to famous doctors, Dr. Hu Shishu had said that dizziness, palpitations, lower limb swelling, or pain and deep pulse are the keys for prescribing Zhenwu Tang. And Dr. Li Wenrui had said that heavy sensation in the extremities or edema, abnormal urination, a white tongue coating, absence of thirst, and a deep pulse are the keys. In Dr. Huang Huang's analysis and presentation of Zhenwu Tang's Fang Zheng, he had enumerated the manifestations, the Zheng, as palpitations below the heart, vertigo, generalized twitching, quivering as if about to fall, abdominal pain, inhibited urination, heaviness and pain in 4 limbs, and spontaneous diarrhea. Really the lines from the text. And he described the person in which, when these symptoms occur, we should be thinking about Zhenwu Tang. Here's the middle-aged or elderly person with sallow complexion, saggy flesh, puffy swelling, lack of stability, upward surging, which can be symptoms like palpitations or dizziness, extreme fatigue, weakness, pain, and heaviness in the legs, loose stools, a deep, thin, forceless pulse, and an enlarged tongue with teeth marks and a moist coating. And finally, the types of conditions for which Zhenwu Tang is appropriate are diseases characterized by deficient desertion, vertigo and tremor, puffy swelling and body cavity effusion, that's accumulation of fluids, hypofunction, diarrhea, infectious diseases characterized by heat effusion, and mental and psychological conditions. My own 3-term summary for the use of Zhenwu Tang are that a lot of the previous symptoms, manifestations can be categorized according to weakness and vacuity, to cold, and to water dampness. So the narrative of these 3 terms are that there is weak yang, which fails to warm the body, leading to cold, and fails to metabolize fluids, leading to the accumulation of water and dampness. This accumulation of water and dampness can then move in different directions and cause different symptoms. So if this water moves upwards, it can cause dizziness, unsteadiness, palpitations, sweating, and we can throw in anxiety and insomnia. If it moves outwards, there can be swelling in the body and twitching of muscles. If it moves downwards, loose stools, inhibited or frequent urination, incontinence, and heavy swollen legs. To look at a few cases from my own clinical practice. The first is a case with the chief complaint of fatigue. And this patient came in first time June 30th, 2022. So about 1 month ago as of the time of my doing this presentation. This was a female patient, 76 years old, and she had great fatigue, very little energy, low stamina, would get tired very easily throughout the day. She experienced restless leg syndrome at nighttime and generally experienced heavy, painful, achy legs. In speaking with the patient, I also learned that she has general fear of cold, easily gets cold extremities, tendency to dry skin. She wakes up with stiff joints in the mornings. She has loose stools, sometimes with some fecal incontinence. Has a tendency to insomnia, dizziness, unsteadiness, and slight swelling in her extremities. Taking the patient's pulse, it was deep and thin. So filtering the different manifestations that could be gleaned from the 4 diagnostic methods, within the category of things that show weakness, vacuity, this was a 76-year-old, so there can be a tendency as we age to have less vigor. She experienced fatigue as her chief complaint. There was incontinence, which shows weakness of the organs and the ability to secure and astringe, and a dry skin manifesting deficiency of fluids or blood. In cold, there was fear of cold and cold extremities. And in dampness or water, we saw loose stools, dizziness and unsteadiness indicating water moving upwards, heavy painful legs with water moving downwards, and swelling in the extremities, again water moving to the exterior and downwards. So I prescribed Zhenwu Tang for this patient with Fuzi at 15, Cangzhu 10, Fuling 15, Baishao 10, Shengjiang 10. The patient took the formula for 3 weeks before I saw them again, and they reported that energy and stamina were much improved. Her legs were no longer achy or heavy, and that achiness and heaviness at night was no longer impeding her sleep. Her restless leg was reduced in frequency, and even when she did have an episode, she was better able to get back to sleep. So her insomnia was reduced. And here I thought there was something meaningful in this case. One, that the energy and stamina were improved, and that's not surprising with Zhenwu Tang. It's translated as vitality decoction for Kampo. And so we do think of it as generally increasing energy, but the increasing of energy during the day helped the patient to be restful at night. So we can treat somnolence and insomnia with the same formula, rather than saying we have to have stimulants to treat fatigue, but sedatives to treat insomnia. So Zhenwu Tang turned out to be very good for this patient, a lot of improvement in a relatively short time, 3 weeks. Second patient, also very recent from my clinic. Here the chief complaint was knee pain. So this patient first came in on June 28th of 2022, 47-year-old female. And she experienced bilateral knee pain and weakness. fatigue during the day, and tendency towards congested sinuses. In speaking with her, I also learned she had anxiety, palpitations and insomnia, dizziness, low blood pressure, experiences light periods, has been diagnosed with anemia, is sensitive to cold and to wind, has cold extremities, and gets intermittent swelling in her fingers. The patient had a pale, puffy, tooth-marked tongue, and her pulses were generally deep and weak, slightly wiry in the left guan position. Filtering these different manifestations again through this lens of weakness, vacuity, cold, and dampness. For weakness and vacuity, the patient described weak knees and fatigue. For cold, there was both sensitivity to cold and wind and cold extremities. And for dampness, a tendency to palpitations, dizziness, that's dampness moving upwards, the anxiety as well, I could have put, swelling in her extremities, the dampness moving outwards and downwards, and the puffy, tooth-marked tongue, indicating simply the accumulation of dampness. So I prescribed Zhenwu Tang with Dangui Xiaoyaosan, here thinking about the light periods and the diagnosis of anemia. Thought about nourishing the blood as well as warming and invigorating the yang and helping with fluid metabolism. So we gave Dangui at 10, Baishao at 15, Chuanxiong at 10, Changzhu at 10, Fuling at 15, Zexie at 10, Zhefuzi at 15, and Shengjiang at 10. A very nice thing about the combination of these two formulas, Zhenwu Tang and Dangui Xiaoyasan, are that Dangui Xiaoyasan contains in itself 3/5 of Zhenwu Tang. 60% of Zhenwu Tang is already in the formula. So simply adding Zhefuzi and Shengjiang to Dangui Xiaoyasan, we can incorporate the herbal methods and formula method of Zhenwu Tang. So again, 3 weeks later, the patient reported knee pain and weakness was about 90% better, whereas it was generalized knee pain, heaviness, achiness, weakness, bilateral, and affecting a large part in the area of the knee. Now it's really localized to the back of the left knee and only when very tired. So it went from being broad in her experience of how her knees felt to being a very small part and only occasional. Her energy is significantly improved. She's less prone to napping. So her somnolence is better. She can get through the day and feel like she has stamina and not have to stop and rest. Her sinus congestion is less. There's less discharge, less mucus, but she still has a feeling of inflammation in her nostrils. So that will become part of what leads this case going forward. Will be potentially shifting to try to address that the mucus is less, but the sense of inflammation is still there. And then the third case was from about 3 years ago. This was a case of swelling in the legs. It was a few months before the pandemic that this gentleman visited me for the first time. A male, 61 years old. His chief complaints were depression, anger, and stress, a cold body and swollen legs. He'd said for about 4 years, but really more pronounced for 2.5 years. And he would take diuretics that would help very slightly and in the short term. When he would urinate more, the swelling would go down a little bit, but not completely, and only for a very short time before the accumulation came back. He also experienced poor sleep. In speaking with the patient, I got the sense that they had terse communication. They did not have a lot of expression in the way that they related to me. And when I asked if they generally felt that it could be difficult to express emotions to others, they relate a story that they had not cried at their brother's funeral, even though inside there was a great deal of sadness, emotion, distress, but they were not able to manifest it with crying externally. And that they did think about this. This was meaningful to them. The patient said that they have very low energy. They gave it a number rating of 10% of their full capacity of what they thought they should have. And tendency to tight upper trapezius muscles and a sense of tension in the upper body, palpitations with anxiety, swelling in the testicles, and proteinuria manifesting with foamy urine. The patient's pulses were generally weak, slightly wiry in the right guan. Now I should describe the patient's build as well. In the upper body, face, arms, this looked like a thin person, maybe even with, we could say, a woody type build, sinewy build. So tighter muscles in the upper body and thinner. And then looking at the patient's legs, they were just uniformly edematous. There was puffy swelling that really hid any kind of bony landmarks. We couldn't see their medial malleolus or lateral malleolus, couldn't see the bones in their feet, etc. So both legs were quite swollen and looked very different than the upper body. So here for weakness and vacuity, there was this great fatigue for 10% energy according to the patient. For cold, a general sensitivity to cold, the difficulty warming up, wearing a lot of clothes and blankets. Dampness, we had swelling in the legs, swelling in the testicles, palpitations, which is dampness going upwards, foamy urine, which could be dampness in the urine. There was constraint here as well. So there's difficulty expressing emotions, this tendency towards feeling stress, anger, and tight musculature in the upper trapezius seemed like the concept of constraint to me. And with the wooden type expression and relationship and eyes that don't really betray emotion, this evoked a lot of what Dr. Huang teaches about the Chaihu eyes and Chaihu face. So we have the Chaihu formula that treats constraint. I selected Si-Ni-San. So here we have our Zhenwu Tang for the weakness, cold, and dampness, our Si-Ni-San for this idea of constraint and for the more thin muscular quality in the upper body, and then Nyoshi to guide to the legs to help water metabolism in the legs, where that's really part of the chief complaint is this swelling. So I gave the patient Zhifudzi at 15 grams, Cangzhu 10, Fuling 15, Baishao 15, Shengjiang 10, Chaihu 10, Zhike 10, Zhigansao 5, and Nyoshi 10. So here, interestingly, Zhenwu Tang does not have Zhigansao. It omits Zhigansao, and Si-Ni-San does have it. I put it in at low dose. We have the concept in Zhenwu Tang, Wu Ling San, Huang Qi Guizhi Wu Wu Tang, certain formulas that deal with water metabolism and the tendency for water to accumulate omit Zhigansao. I chose to keep it in low dose because in Si-Ni-San we have the Xiaoyao Gansao Tang combination, sweet and sour to engender yin in the body, sweet to moderate the urgent tight liver according to the Jing. So to address the Si-Ni-San part of the pattern, I incorporated a low dose of Zhigansao, but not wanting to compromise the Zhenwu Tang approach of water metabolism, I didn't put it higher. After 6 weeks of taking this formula, meeting with the patient again, they were much more animated. They had a warm disposition. The constraint that prevented yang from reaching the exterior, it seemed to kind of thaw. So they had softened up, loosened, and they had a very different disposition. Much improved, and in their own sense, stress and anger were much better. Ability to express emotion were better. The leg swelling was far reduced. Patient said 80 to 90% better, and then I could see definition in his feet. I could see the tendons and bones that had been hidden by puffy fluid earlier. He said that his energy now feels 60 to 70%, up from 10%. So his own subjective sense of being very fatigued with only 10% energy was much improved. And at this point, he mentioned impotence, and we decided to switch to Jingwei Shenqi for 4 weeks. And after those 4 weeks, he reported very good results for impotence, libido, ability to maintain an erection. Follow-up this year, I spoke with him in 2022, and the patient continues to feel very good. He says like a 35-year-old. So now he's maybe 63, 64 years old. And he thinks everyone should take Chinese herbs. And he sends me lots of patients. And so in conclusion, classical formulas, Jing Fang, focus on treating the person, not the disease. This is why they remain appropriate for modern patients 1800 years after they were recorded in the works of Jing. And an understanding of the formula presentation, the Fang Zheng of Zhenwu Tang, gives us a shortcut to recognizing instances in which it may be useful. Very quickly, if we have middle-aged or older patients with a general lack of vigor and a tendency to weakness and cold, we can think about this formula. We also have a clear sense of how to confirm or deny its appropriateness. Are there diseases marked by hypofunctioning of the organs, low metabolism, manifestations of water or dampness in the body? And all of this gives us the ability to safely and effectively prescribe this formula, to reduce the chances of side effects and to increase our chances of clinical success. So that concludes my presentation. I thank you very much for your attention. I hope you enjoy the rest of this wonderful conference and learn from our teachers and colleagues. Thank you.